Well, first off, I just want to be very grateful to come down here and give a presentation to you all. My name is Jelinek. This is Heather Parks. We are with UPMC Health Plan, primarily our Medicare department. I will be speaking on behalf of our Medicare Special Needs Plan, which is the information that I passed out. That is a plan for those that have Medicare and full medical assistance. And then Heather, she can also say a few words about our UPMC for Life Medicare Advantage plan if you guys have any questions about that insurance as well. So I'm going to begin to talk about our SNP plan, and then Heather will follow me up, okay? So if you want to follow along with me, I'm just going to go through this PowerPoint presentation, and we can go through it slide by slide so we can all be on the same page, okay? And if you don't have one, please raise your hand. Okay. Oh, two more.
Coming to you.
Okay. Anyone else? Okay. All right. Alrighty, so by a show of hands, who here has heard of UPMC Health Plan? A good amount. Who has heard of UPMC for Life? Once again, a good amount. What about UPMC for Life Dual? No hands, exactly. So that's why we are here today to give a presentation to create awareness for you guys about this plan out there for those who do qualify for it. So if you can, let's go to page 4 of this paper here. So we'll start off with how is one eligible for this plan? Okay, you have to have Medicare A and B. You have to be living in the plan's service area, which is, as you see on page 5, is all those counties in green, okay? In addition to having Medicare, you also have to be receiving full medical assistance from the state. And for those individuals that have Medicare and full medical assistance, you will see in this presentation of all the great benefits that they will qualify for no additional cost, okay? And one last thing is, this is a CMS guideline rule across all plans is you cannot have stage 5 permanent kidney failure, which is end-stage renal disease, okay? So if you can, we'll continue on to page 6. As I mentioned, UPMC for Life Dual, we offer more benefits and services for no additional charge, okay? And with this plan, it gives you access to the top-ranked care hospitals and providers in this area. And the Meadville Medical Center is par. So you can continue to go to that hospital, okay? In condition with that, you know, you can go to Hammett and St. Vincent's up in Erie. Just because you have a UPMC health plan insurance with this plan doesn't mean you can't go to St. Vincent's. You can still go to St. Vincent's and Hammett as well, okay? And with this plan, as you see there, it comes with our award-winning customer service. Year after year, they have been winning awards for their great response time and their level of care that they're able to give over the phone to our members. And I'll also talk about our health coaches in addition, okay? So on page 8, with UPMC for Life Dual, you can continue to expect the same level of care that you have been receiving, such as your PCP visits, your specialist visits, ER, lab, speech therapy, mental health, home health care, occupational therapy, and more. And each time you go to these appointments, there is no copay, okay? So once again, if you do qualify, there is no copay, and I will go through those in addition, okay? With this plan, if you become a member, you know, we are your primary insurance. We would send you a card in the mail, and then when you go to your doctor's office, or if you go to the pharmacy, you would show them our card just like you would now with your current insurance coverage, okay? Same thing when you go to the pharmacy, you show them our card, and we really don't have that big of an issue when it comes to the network. It is quite large in this area, so there's a very good chance that your current doctors are already accepting these UPMC health plan products, okay? Okay, so let's continue on to page 10. So like I mentioned, if you qualify, there is a $0 monthly fee. And just to reiterate, if you have Medicare A and B, and full medical assistance, you do qualify for this plan for no premium. When you go to see your doctor or specialist, there are no copays. Same thing when you go to the ER, there's no copay. The only time you may have a copay is when it comes to your prescription drugs. Usually if it's a generic, it's $1.20. If it's a preferred brand name drug, it's $3.70. Okay, so that's the average. It could be less, it could be more. That just depends on your level of extra help from the state. Okay, even if you do a mail order with our plan, you'll get a 3-month supply for the price of one, and we go through Express Scripts if you guys are familiar with that company. Okay. So now I would like to jump to the meat and potatoes of this presentation, and that's page 16. Okay? And in addition to that, if you want to grab this book right here, this one, and go to page, I believe, 6. And I'll wait until you're all there. So this one, go to page 6, and then the other one will start at page 16. So the reason why we are out to create awareness is because those that have Medicare and full medical assistance, they're already, not paying a copay when they go to their doctor's appointments, and they already don't have a monthly premium. But where do we come in? That's on page 6 of right here. So you see all of those red X's? That's if someone just kept their Medicare and their access card. But with this plan, you're gonna get all those extra benefits with the green check mark that they do not currently have. They don't have the over-the-counter benefits. They don't have the vision and the dental and their transportation. This is all included for no additional fee. So for those that do qualify for this plan, it is very, very beneficial for them. And I'll go through each one of these benefits for you. What we're very excited about is our brand new over-the-counter benefits. So as you can see on page 16 with this pamphlet, you will get a debit card in the mail, and every 3 months, we'll put $125 on this card. The next quarter, we'll put another $125 on this card. So for the whole calendar year of 2018, you have $500 that you can use to purchase over-the-counter items listed right up here, such as cold, cough, and flu medicine, vitamins, toothpaste, even sunscreen, and much more. So you go to the store, you use your debit card that we send you, okay? And then whatever you spend, that's where your card will go down to. So you start at $125. If you spend $20, now you're at $105 left on your card. And then the next quarter will give you another $125. So as you can see, you receive a lot more benefits and services with this plan, just with Medicare and Medicaid. Next, we offer comprehensive dental services. So as long as you go to participating providers, you will receive 2 cleanings per year for no copay. And we will also give our members a $2,500 allowance to go towards comprehensive dental services. So each year, you'll have $2,500 to go towards services such as dentures, partials, bridges, root canals, simple tooth extractions, or even crowns, okay? And then to follow that up with is our vision benefits. Each year, it's a $0 routine exam for an eye exam, and then you will also receive $250 allowance to go towards glasses. And that is every year you will receive that allowance to go towards vision and dental, okay? Also, we offer transportation services. So if you needed a ride to an appointment, we can take you there and back for no charge. That's 50 one-way trips per year or 25 round trips per year. So if you need a ride to a doctor's appointment and you can't get there, we can be that service for you. You give us a call 2 days in advance, and it's a whole one-on-one experience. We have the driver come to your house, pick you up, take you to your appointment. He or she will wait there for you and then take you home, okay? And so once again, that's an added benefit with this plan for no additional fee if you or someone you know that may qualify for it, okay? So far, are there any questions that come to mind that I can answer for you at the moment? No? Okay. Well, we'll continue with, oh, go ahead.
The transportation, would it be through CATA?
That I'll have to follow up with you on exactly who the provider is, because it varies on each county. I know in Erie County it's Emergicare, we use them, but for Crawford County I have to look that up for you to see who the exact provider is, okay? But it is a whole one-on-one experience.
I don't know who else it'd be.
Right, probably will be them if there's nobody else.
They cover Crawford County.
Right, yeah.
Now they're gonna cover Venango now, I mean, in the future. It's gonna be a, what are they gonna call it? You only stop at the special places like the hospital here, the doctors,
Right,
up on the hill, Vernon Place.
right.
I mean, no stops at your door.
And so with this, like I mentioned, they will actually wait for you at the doctor's office, and they can help you get from your door to the car and back, okay? And there is a 30-mile radius in terms of how far you can travel, but we do make exceptions. Is if, say, you have to go to Pittsburgh for a surgery and you can't get there, they can make an exception for, major procedures like that, okay?
17 miles one way from me, from my place to here.
Then you're good? You're
One way.
Right. And this is for, medically necessary reasons, so for doctor's appointments, to go to the pharmacy to pick up your drugs, things like that, okay? Also, which is great with this plan that really no one else offers, are the bathroom safety products. So we send you 6 items for no additional charge. We send you a non-slip bath mat, a raised toilet seat, a transferred shower chair, even a new handheld shower head. For no additional cost, we ship these right to your doors, okay? And in addition, we even provide you with meals. Say if you've been discharged from the hospital or been discharged from the nursing home, we will send you about 14 TV dinners that'll last you about a week until you can get back up on your feet, okay? So as you can see here with the over-the-counter card, the vision, the dental, transportation, the hearing benefits, the meal services, bathroom safety products, and that's not all. We even offer gym memberships with this plan with our Active and Fit program. So we would send you an Active and Fit card in the mail, and you can go to the gym here in your area for no charge at all. If you don't want to go to the gym, we will even send you workout DVDs that you can do at home if going out to a public setting isn't your thing, okay?
I have it at Camp Silver Snickers.
Okay, so
It's covered.
right, and then Heather, she can probably talk to you a lot about Silver Sneakers with UPMC for Life. Yes, yeah, so she can definitely, Silver and Fit, she can definitely talk to you about that. Okay. All right, guys. In addition, each member gets their own personal health coach. Okay, they can talk to them about any questions they have about stress, weight loss, smoking cessation, or whatnot. And that's very unique. Each individual member has their own health coach to really get them on the path that they need to be, okay? Even if you have access to the internet and you don't want to go to your doctor's office, you even have the capabilities of our Anywhere Care program, where you can have a one-on-one consultation via the web, basically. And so a lot of our members have been taking, use of that so far. Okay, so those, as you can see there, as I went through here on page 6, you get so much more if you do qualify than you would if someone just stayed with their Medicare and their access card. Okay, a lot of the questions I receive are, well, this is an HMO plan, I have to stay in the network, what if I travel? Well, that's a great question. With our Assist America program, you are covered if you travel out of state for all emergency-based situations. Same thing if you travel out of the country, you are covered for all emergency-based situations, okay? If you're in Florida, if you're in Texas, or if you're in Canada, if something happens to you that's an emergency, you're treated at the same copay and level of care as if you were back home. Even if you, oh, go ahead.
Does that include South America and?
Any country, any country. Any country, yep. Also, if you happen to forget to bring your prescription drugs with you, say you're traveling to a different state and you forget your drugs, we will help you find the closest pharmacy where you can get your drugs at the same copays if they were back here, okay? So this is, people sometimes are afraid if they enroll into a plan that's just in Pennsylvania that they don't have coverage when they travel. That is a myth because you are covered for all emergency-based situations. You just can't go in for any elective services, like you want to get a routine, eye exam or see a doctor. But we do have, with our UPMC for Life plans, we do have Florida coverage. For all those snowbirds that go to Florida, you are covered in network in that state, okay? So as you can see here, there are a lot of benefits with this plan for those that do qualify. If you are eligible and you are thinking about enrolling or applying, you can enroll at any point. There is no open enrollment period with this plan. Whenever you enroll, your coverage will start on the first day of the following month, okay? And that's any month, and it will always start on the first day of the following month. Also, a good thing to know is what if you're on this plan and the state takes away your medical assistance benefits? That happens to individuals, and we will still cover you for 6 months. So if you're on this plan and the state takes away your medical assistance benefits, we will cover you for 6 months on a grace period, and on that last month, we will help you find a plan that you are eligible for at that moment, okay? So as you can see here, with this plan, it is more than just a health insurance plan. It's a wellness plan. You get a lot more benefits that you deserve and services that you can use rather than just staying with your Medicare and Access card if you do qualify. So like I mentioned, we will send you a card in the mail, and that would be the card that you use going to your appointments or to the pharmacy. And you could reap in all of the extra benefits that you deserve with this plan if you happen to become eligible for it. So you may not be eligible for it, but you may know somebody who does that can really benefit from these services. Okay. So at any point, if you have any questions or if you're interested, you can contact me. I am the representative for the Northwest tier of Pennsylvania, okay? You can call me directly if you're interested or want to apply or just have any general questions, okay? But before I conclude, does anybody here have any questions in particular to this plan that I can answer for them? Yes?
Just to back up to your opening statement, if you don't have those cards,
right,
you are not eligible.
This is a very niche plan, okay? So this is right. So you have to have the Medicare and Access. So like I mentioned, there's a good chance that you may not qualify, but some of you may. But you may know a friend or a family member that may be eligible, okay? So our goal is to bring out awareness about this plan. We have about 25,000 members on this plan as of now. So it is growing year after year.
Well, I got all this information in the mail because I
Okay.
didn't have you
Okay.
in live.
Okay.
But reading it, I thought to myself, I don't qualify.
Right. So
And you're verifying it.
absolutely.
Okay.
Right. So basically, you have to have Medicare and Medicaid to be on this plan. So you may know somebody who does have those both cards, and they may really benefit from this because all of those services I went over, all those benefits I went over. If they just kept their Medicare and Access card, they are not receiving the over-the-counter or the transportation or the dental or the vision. So that's why it's our goal to get out there and really make this awareness for all those individuals, okay? Any other questions? That was a good one. Yes?
I got the application in the mail for that card,
For the
or you go get it.
Access card?
No, I got the access card.
Medicare?
I got that one too.
Okay.
But it's the card that you can go get. You want to go first then?
Okay, so are you a current UPMC for Life dual member?
Yeah.
Okay, so you're talking about our over-the-counter card.
Yeah.
So we're going to send you a card, okay?
But I go to call it to activate it. And they said I'm not in the system.
Okay. We have heard of when it just started in January. I have heard of some minor issues with it with some members, but they are getting resolved as we speak. Once your case gets resolved, you'll be able to go to the stores to use it to purchase those over-the-counter items. And like I mentioned, you'll have $500 this year for that. Okay?
Hey, what is it on mine?
Well, it's $125 every quarter, so that's $500 for the whole
Oh,
year.
for the whole.
Yeah.
Okay.
Absolutely. Any other questions?
Oh, I got a bill in the mail, and they're charging me 1,000 and something for deductible. And I don't know if I should have that.
No, there's no deductible with this plan. You and I can have a side conversation, I can look at your
Okay.
information,
Okay.
because with this plan, there's no premium, no deductible, and there's no co-pays either for your doctor's appointments, okay? So, once again, I just wanted to bring awareness to you guys about the UPMC for Life dual plan for those that are eligible for it. If you or somebody you know are interested, please feel free to reach out to me. I can give you a business card, and then we can talk from there, okay? And then just for a few moments, I think Heather's going to speak here to talk just a little bit about our UPMC for Life Medicare Advantage plan, okay?
Whether you want to hear me or not.
All right, so here she goes. Thanks, guys.
Good morning, everybody. All right, let's start off with who has UPMC for Life, the Medical Advantage Plan, the Part C. The Advantage Plan. So if you have a UPMC for Life card, chances are you are a member. I hope so, but that'd be weird. Was anybody at our member services meeting last year? We held it right here at the Lou Davies Community Center. Was anybody here for that? No? I think it was October. I was here.
Remember.
I don't know, for 2 months straight I travel everywhere. So I might have been here mentally, physically, one of the two. I was around here. But anyway, my name is Heather. I'm the Community Relations Coordinator for UPMC for Life, the Medical Advantage Plans. Chances are, if you already are a member, you already know about the benefits you do have. So I don't want to get into the nitty-gritty as far as the HMOs, the PPOs, any of that. I just want to go over the extra stuff that you have, which is the difference between your Part C plan, which is what you would have if you had one of our cards, versus just having Medicare Part A and B. And a lot of the stuff is similar to the dual plan that Joe spoke about earlier. So going over that, you do have the free health coaching that you would call in. You call your healthcare concierge. They go over, I believe it's diabetes, smoking cessation, stress relief, and that's all to access to you if you are a UPMC for Life member. Some of the extra stuff along with that is you have access to the mobile app. Does anybody have the UPMC health plan app on their phone? Me either. But the one time I used it, you can use it on a desktop as well. It's called your Anywhere Care app. So the example I like to use is that my one coworker, she ended up getting sick and we were traveling all the time. So she didn't have time to go to the doctor whenever she was sick. She got on the UPMC health plan, the Anywhere Care app, and she talked to a doctor right on their phone. She's staring at the doctor right at him and he said, "Open up your mouth," and he looked down her throat, found out she was sick. I said it was the most amazing thing I've ever seen in my life. So I almost want to get sick just so I can use that app so I can talk to a doctor. But that's one of the options you have as far as the health plan is concerned. You have that Anywhere Care that if you don't have time to go to a doctor, you can get right on that app. They check you out, they send your prescriptions right to your pharmacy, and you didn't even have to leave your couch or your pajamas, which I am all about. I wear sweatpants all the time. So some of the extra stuff, whenever Joe was talking earlier, he spoke about the Active and Fit membership, which is the fitness benefit. Silver and Fit, so if you are a UPMC for Life member, you have the Silver and Fit fitness benefit, which gives you access to fitness facilities at no cost. You just show them your UPMC for Life card. I believe, does anybody work out here? You do?
Up at Vernon.
Yeah, up at Vernon, that's where it is. Vernon YMCA, is that the?
They have a,
Yeah, your little key fob. But you would just show them your card, say I'm a UPMC for Life member. If you're not sure what facilities around here take Silver and Fit, I can always look that up for you after. I believe Vernon YMCA. There are a couple more around here as well. But you can go into the facility, use the facility at no cost. If it's snowing outside and you really don't want to go outside for a few months, like a lot of us, like me, do, you have the same access to getting DVDs sent to you that you can do workouts at home as well. So that's one extra option.
do that.
I'm all about that.
How do you get that?
You would call the Silver and Fit phone number, so you can either call your healthcare concierge, and they send you 2 DVDs a year, which is pretty cool. So you can get DVDs at home. Once you get the DVDs, you can go back to the gym, because some people, like myself, don't like to go outside whenever it's not 70 degrees. So if I got a DVD sent to me, You could do that at home, and then once it gets nicer, you can go back to the gym as well. So that's another option. The one thing I really want to talk about with UPMC for Life is a little bit of the changes as far as the pharmacies are concerned. If you have certain prescriptions, let's say you're going to Giant Eagle or a Walmart or some of the larger retailers around here, a lot of those are preferred pharmacies now. So if you go to a UPMC for Life preferred pharmacy, your prescriptions, depending on what they are, can be filled with a $0 copay. So I definitely recommend, if you are a UPMC for Life member, going to whatever pharmacy you're going to make sure your prescriptions are either a $0 copay or whatever they are supposed to be. And we can always go over that after. Feel free to come up and talk to me. But like I said, I don't want to get into the nitty-gritty. My whole philosophy is I'm happy you have insurance no matter what it is. My goal is to make sure you don't ever have to use it. So if you ever have any questions at the end of the presentation, come up and talk to us. Joe, do you have anything else?
Make sure you guys grab stuff. We have a bunch of giveaway items to give, so don't leave empty-handed.
We have
okay?
pens
Pens
and rulers
we'll
slash
get it,
bookmarks
so don't be shy. Come on
and
up.
toothpaste. But thank you all so much for letting us come in and hang out on this beautiful spring day in Western Pennsylvania. If you have any questions, feel free to ask. Thank you very much. Have a good day, everybody.
Thank you so much.